Tantum Verde is non-steroidal anti-inflammatory drug. It has an anti-inflammatory and local anesthetic effect, has an antiseptic effect against a wide range of microorganisms. Indications: symptomatic therapy of pain syndrome, of inflammatory diseases of the oral cavity and end organs, of various etiologies, gingivitis, glossitis, stomatitis, including after radiation and chemotherapy, pharyngitis, laryngitis, tonsillitis, candidiasis of the oral mucosa as part of combination therapy, calculous inflammation of the salivary glands, after surgical interventions and injuries, tonsillectomy, jaw fractures, after treatment and extraction of teeth, periodontal disease. In infectious and inflammatory disease requiring systemic treatment, it is necessary to use Tantum Verde as part of combination therapy. How to use: locally, after meals, adults including elderly patients and children from 12 years of age. Use 15 ml of the drug. A measuring cup is attached 2 to 3 times a day to rinse the throat or mouth. After rinsing, the solution must be split out. If a burning sensation occurs when using an undiluted solution, the solution shall be diluted. To dilute, add 15 ml of water to a measuring cup. Do not exceed the recommended dose. The duration of treatment should not exceed 7 days. If after treatment within 7 days there is no improvement or new symptoms appear, it is necessary to consult a doctor. Use the drug only according to the method of application and in the doses indicated in the instructions. If necessary, please consult your doctor before taking the medicine. Contraindications: hypersensitivity to benzidamine or other components of the drug. Children aged up to 12 years. Carefully, hypersensitivity to acetylsalicylic acid or other non-steroidal anti-inflammatory drugs, bronchial asthma, including history. Special instructions: if a burning sensation occurs during the application of the solution should first be diluted with water 2 times by bringing the water level to the mark in a graduated glass. When using Tantum Verde, hypersensitivity reactions might develop. In this case, it is recommended to stop treatment and consult a doctor to prescribe the appropriate therapy. In a limited numbers of patients, the presence of sores in the throat and mouth may indicate the presence of a more serious pathology. If symptoms persist for more than 3 days, a doctor should be consulted. Side effects: local reactions, rarely, dry mouth, burning sensation in the oral cavity. The frequency is unknown, a feeling of numbness in the oral cavity. Allergic reactions, infrequently. Photosensitivity, rarely. Hypersensitivity reactions, skin rash. Pruritus, very rarely. Angioedema, laryngospasm, frequency unknown. Anaphylactic reactions. If any of the side effects indicated in the instructions are aggravated, or any other side effects not indicated in the instructions are noted, you should immediately inform your doctor.